How do decibels impact hearing loss? Have you ever wondered how the loudness of sounds affects your hearing? Decibels, often abbreviated as dB, are the units we use to measure sound intensity. Understanding decibels is crucial for maintaining ear health and preventing hearing loss. Sounds at or below 70 decibels are generally considered safe, even with long exposure. However, sounds at or above 85 decibels can lead to noise-induced hearing loss, especially with repeated or prolonged exposure. The relationship between decibel levels and safe listening time is important. For every increase of 3 decibels above 85, the safe listening time is cut in half. For instance, at 85 decibels, you can safely listen for up to 8 hours. But at 88 decibels, that time drops to just 4 hours. If the sound reaches 91 decibels, you should limit your exposure to only 2 hours. This means that louder sounds can damage your hearing more quickly, requiring shorter exposure times to avoid harm. Noise-induced hearing loss occurs when loud sounds damage the tiny hair cells in the inner ear that are responsible for detecting sound. This damage can happen suddenly, like from a loud noise such as a gunshot, or gradually from frequent exposure to loud environments, like concerts or construction sites. Unfortunately, this damage is often permanent because those hair cells do not regenerate. In addition to hearing loss, exposure to loud sounds can also lead to tinnitus, which is a persistent ringing or buzzing in the ears. Sometimes, after being in a loud environment, you might think your hearing is back to normal, but the damage can still be there, lurking beneath the surface. Recent research has uncovered some fascinating details about how noise-induced hearing loss happens at a molecular level. For example, scientists have found that exposure to loud noise can disrupt zinc levels in inner ear cells, contributing to cellular damage. This understanding could pave the way for future treatments aimed at preventing or reducing hearing loss caused by loud sounds. To protect your hearing health, it is essential to grasp how decibel levels and exposure time work together to determine your risk of hearing damage. Remember, sounds below 70 decibels are unlikely to cause harm, while sounds above 85 decibels pose increasing risks. Hearing loss from loud noise often develops gradually, so it may go unnoticed until significant damage has occurred. To maintain ear health, consider these preventive measures. Limit your exposure to loud sounds, use hearing protection when necessary, and follow safe listening guidelines recommended by health authorities. By being aware of decibel levels and taking steps to minimize noise exposure, you can reduce your risk of noise-induced hearing loss and preserve your hearing for years to come. Always consult with healthcare professionals for personalized advice on hearing health.